You're watching a KARK special, Coronavirus Concerns, Reopening Schools in Arkansas.
In a lot of schools, of course, the school nurse is the point of contact if someone contracts coronavirus. That's the first person they'll go to. Dr. Dillehay, I want to bring you back in to talk about COVID-19 and children. It is something that's been talked about by a number of different doctors and scientists, saying that children don't feel the most effects of coronavirus. They seem to weather the storm better than adults do. What is the science behind this as far as we're going into a classroom? Because we've got children, and then of course their teachers who are adults, and then passing this from one place to the other. What are your concerns there scientifically? We've seen the systems now that are in place to try to keep teachers and students safe. What's the science now of heading back to school?
Well, we know that students or young people tend to weather the coronavirus when they get it better than adults. But there are still lots of things we're learning about how it impacts children. For instance, kids can have the multi-organ inflammatory syndrome, which is new. We understand more and more that children's hearts can be affected. And so now there's guidance out from the cardiologists about clearing children to return to sports after they've had COVID-19. So there's a lot we're learning about children and COVID-19, and we're just going to have to be cautious and not assume, because we don't know, that there aren't long-term effects. It's going to be important for us to be careful about how we monitor children and the adults in the classroom and protect them. And I'm very happy that there's been now a strong push for face coverings and in the classroom as well as around the state, because I think that's going to be really important to dampen the spread of COVID-19 in Arkansas.
And here we are, Doctor, we're getting ready to get back to school. We still have a bit of a warm summer to get through, but we know that flu season is right around the corner, and we gear up for that. Generally this time of year, we're all taking a look at what the latest flu strain is and the vaccine that's out there that will or won't be effective. How does this compound the problem?
Well, I think it will make the problem more complicated because symptoms are similar. It'll be confusing about, does someone have COVID-19? Do they have the flu? Of course, people can have it at the same time. It's going to be more important this year than ever for people to get a flu vaccine, because that's how we'll keep people out of the hospital with the flu, because our hospitals will have a lot of pressure on them with COVID-19 patients for which we don't have a vaccine yet. So getting a flu vaccine is going to be really important for kids, because kids are just really efficient spreaders of the flu. And it's going to be important for the adults to protect themselves. And then hopefully after the first of the year in 2021, we may very well have a COVID-19 vaccine. And that's our hope. It's possible. I'm not sure how likely it will be, but it's possible. And then we'll want to make sure people are protected with that vaccine.
Any advice you can give out there to school nurses getting ready for this year?
Well, I think patience is going to be one of them, and to make sure that they're well connected with the local health unit and the health department nurses. We have community health nurse specialists who work with our nurses, and we're going to work together to make sure that the school nurses have what they need and can rely on the health department to provide them guidance for when they do encounter illness.
We got to talk to this about when we talk about kids too. When it comes to school, recess is something that's apparently going to be part of the school day, and students will have to social distance during that on the playground. That even possible, Michael Poore?
Well, I want to first just take off on Dr. Dillahay's comments that also parents can help us right now by getting immunizations taken care of and go ahead and moving forward on wellness checks. And we know that both of those things are not happening at the pace that we would like. And so that's really critical right now as we start the school year, and something that will benefit our nurses, benefit a more healthy school environment. You know, our teaching staff and our classified staff at the schools are really great at working with children and knowing how to get the best out of them in every situation. I agree with you that that's not the easiest thing to accomplish in a hallway or in a lunchroom or in a cafeteria. But I really believe that our professionals will find ways to make sure that we continue to emphasize the whole social distancing aspect. Of course, the other thing tied into masks is that we will have masks even if people don't remember them. We ordered 3 million masks last week just to be ready for kids that forget their mask. So we are going to be prepared to try to prevent, any kind of situation where children are not protecting themselves and protecting others.
Well, I can't tell you how many times I asked a teacher or an administrator for a number 2 pencil because I left mine at home, even knowing how important it was for the day. So yeah, masks are going to be one of those things that kids will have to try to keep up with, and of course a school will have to make available. Arkansas's Education Association asked district employees if COVID-19 made them think about leaving the public education profession or retiring earlier. Almost 37% said no, 30% said they considered leaving the profession. 10.5% said they consider retiring earlier than planned. Secretary Key, I want to ask you about this. Is that pretty much accurate from what you're hearing across the state?
Well, I wouldn't take issue with their survey. I haven't looked at it in detail. I mean, those numbers are what they are. There are between, I think, 38 and 40,000 teachers in the state of Arkansas in our public schools. And, we hear both sides. We hear the concern. We hear also from teachers who are saying, look, the digital learning, the virtual learning is not what my students need. I need my students in class, and I'm ready to get back in class with them. So, it's really about those, how are those local plans going to address the needs and take into account the feedback from those teachers. A lot of the fear will be resolved by local conversations. And we have heard from a number of districts around the state that have been doing that, having those local conversations, and the staff, the teachers, the support staff there are feeling comfortable about their back to school plans.
All right, Secretary Key, thank you very much. Carol, I want to hear from you in a minute, but first we have to take a break and wrap things up right after this.